voilà, quand nous sommes dans Topik conversation aujourd'hui bon matin, et pareil, moi dit dans Topik aujourd'hui, bien si nous cause l'eau s'assise obésité, bien si c'est le pas gagner panier avec obésité et nous besoin cause là, de temps en temps nous besoin cause là, et justement dans Topik conversation, nous en a un bariatric and metabolic surgeon qui nous demande Dr. Nirupam Sinha qui nous demande aujourd'hui bon matin, et pareil, moi dit puis bonnet, autres basé côté Victoria Health Clinic, bien sûr, qui nous cause un petit peu là, il y en a solution pour tout problème. Tout le temps nous dit ça, soit on est un petit peu trop gros. Par exemple, on peut essayer de faire descendre 100 kilos, autres mati. On nous dit qu'il faut souffrir pour être belle, mais seulement nous pas descendre du tout. Il y a des autres solutions qui sont capables de faire. Aujourd'hui, bon matin, c'est ça qui nous peut aborder dans le topic conversation, bien sûr, pour aider ou retirer ou problème, bien sûr. Et là, bon matin, nous cause obésité. Docteur, il visite nous pour la première fois. Aujourd'hui, de bonjour Cécile, et dis-moi, Diou qui nous interview, qui pour en anglais, à cause justement, docteur, il cause anglais. Envoyez une question, créole, anglais, français, envoyez-les, et nous, on fait toute une façon pour nous translate, ou soit la façon que vous sortez confortable pour envoyer une question, envoyer, et nous, on va faire docteur connaît et on va gagner la réponse. Alors, restez attentifs aujourd'hui. Bon matin, Dr. Nuripam Sinha, good morning.
Morning, how are you?
How are you?
I'm good.
Good for Tuesday, and you?
I'm good, absolutely fine.
Did you sleep well?
Yeah.
Everything okay?
Absolutely fine. Thank you for having me here.
It's a pleasure. Do you know how to speak Creole?
Yeah, a little bit. I'm
Little bit.
understanding, but not that much. But we'll definitely see to it.
But not the bad words, no?
Yeah.
So you are bariatric and metabolic surgeon at the Victoria
I'm a bariatric and metabolic surgeon.
Health Clinic. So far, what have you observed?
That's a pretty good question you have asked me. Because so far what I have observed and how, why I have chosen this subject as my profession. Because I have seen so many of patients in my life regarding each and every thing, regarding each and every disease. But all those diseases, most of them were related to obesity. And I thought that why not I should be much more get my expertise in this obesity treatment and obesity management. And once I did my the training in this obesity management regarding the surgical and the non-surgical aspect both, I realized that this is the one major cause for all of the diseases which the patient are used to, the normal person is carrying straightforwardly at present. And the most important factor was they used to treat all those kind of comorbid conditions which were associated with the obesity, but they were not treating the root causes. So yeah, that's why I gave a thought of having my training itself in obesity management.
Obesity, and for the benefits of our viewers this morning, let's start with the first question.
Yeah.
What is obesity?
Obesity is basically, in a layman term, I'd like to tell you, not in a medical term, it's like a chronic disease. First of all, we should consider obesity as a disease only. It's not a lifestyle changes now. So it is a disease which can be there because of excess deposition of fat, excess deposition of bad carbohydrates, and rest of the other things also. That will lead to severe health issues, significant health issues in your life. So that's the layman term for an obesity which we can define it. Otherwise, if you'll go to a medical definition, it's like chronic, relapsing, and because of excess accumulation of fat that will lead to adverse effect on the body, like that kind of definition which we can have.
We say it's a chronic disease because of what we consume, excessive consumptive of fats, I don't know, carbohydrates, and everything. But some people tend to forget that.
Yeah,
only when that we are obese that we say, oh my God, I'm too fat, I'm too overweight, I'm too obese now, is the time to remove the fat. It's not that easy, isn't it?
No, it's not at all easy. See, I always used to, whenever I used to talk to my patients, I always used to tell them that obesity is a state of mind that leads to a disease of body. Because if you are controlling your mind and you know what you have to eat, what you don't have to eat, what's good for your health, what's not good for your health, then definitely you are not going to become obese. Definitely you will be some sorts of overweight, but you will be in that obese category. Okay, so really you have to train yourself accordingly, so that what is good for your health you should know about it. All right, and the most important factor is definitely it requires a lot of consistency, a lot of persistence, and a lot of dedication to maintain your health. That's the thing you have to do.
Pour qui de la cour qui peut que nous là au matin, il concerne discipline avec nos propres corps persister, pareil, docteur, il dit qu'il faut persister, discipliner, contrôle, quoi qu'il peut manger, bien sûr, dans l'état qui nous pas capable, comme si la tentation est là, ou une petite fonction, un petit quelque chose, oui, ça. Without feeling guilty, nous mangeons, mais seulement pas faire tous les jours, à la base tous les jours, à cause il peut faire nous du mal dans nous les corps, bien sûr, dans quelque chose qui nous les corps pas capable de contrôler. Trop beaucoup de sucre, trop beaucoup de sel, is one of the factors, isn't it?
Yeah.
Too much sugar, too much
Absolutely.
salt is one of the factors.
Processed food, too much sugar, too much salt, too much fats.
Too much carbohydrates.
Too much carbo. All too much will be good for.
All too much.
All will be good for. Will be bad for your health.
All that is good in our mouth is not good for our health.
Absolutely. That's what I want to. I always used to tell my patients that what tastes good is not good for your health.
Exactement. C'est ça. Aujourd'hui, bon matin, nous pouvons aborder, s'assiser, nous tout à un point. Pareil, nous dit, nous feel guilty à cause nous voler. Bon, de temps en temps, moi passer, moi prends un petit ice cream, moi passer, moi prends un petit pizza, un petit quelque chose. Nous voler, pareil, nous dit, nous cheat, le manger, mais seulement, si nous pas faire de base tous les jours, pas supposé affecter nous. Mais si on peut faire tous les jours, this is the main problem. Doctor, can we differentiate between the word overweight and obese?
Yeah, that's a that should be actually be knowledge to every person. That how can you tell a person that you are a normal weight person, an overweight person, an obese person? So that depends on like a normal thing which we used to call as body mass index, called as BMI.
BMI.
So BMI is basically what should be the ideal weight according to your height. There's a formula to calculate it. So when we used to calculate according to this the given data of a patient, we used to think that we used to categorize this patient into normal, overweight, or obese class 1, class 2, or class 3. So I'll tell you the brief. The normal BMI normally which lies is about 18.5 to 24.9. All right. If you are in that category, that means you are having a normal BMI. All right, and that means you are healthy. And if you are up to 30 of BMI, that means you are overweight.
Overweight.
So up to 30, you can consider yourself as an overweight person. But if you goes beyond that, that means up to 35, that's obese class 1. Up to 40, that's obese class 2, and more than 40, that means you are just a par, okay, and you are morbid obese now.
Vous super suivre ça bien dans la cour. Est-ce que vous connaissez BMI? Moi, je crois plus qu'il est pour nous guetter cour nous BMI à cause de nous dit overweight inexpliqué. Là nous dit obèse aussi dans son différentes catégories qui nous pourtant là-dedans. When do you consider that it's obese?
Yeah, we have to see most of the things, like we have to really examine the person first, and then we have to do some of the tests like body composition analysis and the waist hip ratio and the fat, other things like we have to consider it, and then only we can tell the patient whether the patient is really overweight or only the bone density is much or the fat mass is much or what is much. Okay, so we really have to see the patient once, and we have to consider accordingly what has to be done further to categorize them as overweight. But the basic thing to that a normal person can also do is to calculate his BMI, so that he can feel that okay, I am now overweight, I am not obese, so he can do it like that.
Bon, dis moun de la cour, calculer zot BMI, sinon, si vous avez des difficultés, vous avez toujours descendre, bien sûr, et un moun qui peut spécialiser de sa bonne affaire, il est capable de faire ça pour vous, et vous avez une direction, une guidance qui m'a pour aller, pour retourner derrière, bien sûr, pour aller plus devant, côté nous la santé concernée, nous être plus concernés, à cause comme il y a une tas maladie. And doctor, there's lots of diseases relate to the obesity.
Yeah. You start from top to bottom. You will get everything related to obesity. Okay, so I'll start with some of the basic things which normally the patients used to have. First of all, the patient will not be able to walk. Okay, the one who has excess body fat, more than like 50% of the normal thing, if he walks for suppose if like 500 meters also, he will pant. He will be like standing, he will be gasping for some air, he will sit for some relaxation, then he will walk. So what's the use of that fat? There's no any use of that. So the first thing is like you will not be able to walk. If you will not be able to walk, your heart will not function as that good as it has to be function. So the cardiovascular risk is more. You will not be able to sleep properly. That is called as sleep apnea, and those patients used to snore at night.
Some people tend to snore. Is that a factor?
Yeah, that's one of the factor of snoring, because if you have excess fat, so you'll be having fat in this area also, the neck area. So you'll be having double chin and other things as well. So when you sleep, when you are in conscious state, you know how to breathe. Okay. But when you are in sleep, you are unconscious. Okay, you don't know how to breathe. So when whatever you used to take breath, all the oxygen used to get stuck in your neck area and it doesn't used to go down. So what happens normally in these patients, they used to wake up in the morning, wake up in the night suddenly, and they used to gasp for air, and then again he used to sleep. So this is called as obstructive sleep apnea. Because of that obstruction, he is not having the proper oxygen which is going inside. Now this is one of the part. Now you can go for this, patient can develop diabetes, patient can develop hypertension, patient can develop hypercholesterols, high cholesterols, then the gouts, low back pains, joint pains, multiple problems. You tell it, you name it, and you will have it.
And
It's like that.
have it. Pas non, mais plutôt, parce que pour gagner plutôt, pas non, mais c'est important. Peut-être il nous périer, mais souvent il est important pour nous veiller nous la santé, s'il vous plaît. Sinon nous pourrons nous faire pas quelque chose, merci, et justement, comme Victoria Health Clinic, il y a un endroit qui y a un remède. Par exemple, il y a une solution pour un problème before you will do a surgery regarding obesity. What is the consequences? What do we need to do?
Definitely first, obviously we never used to jump for the surgery at first. First we always used to check the BMI. See, that's why I told you. If the BMI is more than 40, that means that person requires a surgery. Because with any sorts of treatment, either non-surgical, the medicines or whatever the treatment you want to give to the person, that will not be that much beneficial to that patient of that severe BMI. But if a person lies between 35 or 30, you can definitely tell them to have some lifestyle modification first. So always go with the lifestyle modification first. That means you have to have your physical activity. That doesn't mean that you should hit gym only. It's not like that. You should walk.
It doesn't work.
It doesn't work, so you have to walk.
It doesn't work.
Yeah, you have to walk, and then you have to have some proper meal with a nutritionist plan. And the main thing is the consistency, because there's something called as hunger brain. There's a term called as hunger brain. See, the problem with all this type of the diet which is coming at this present scenario, like keto diet, paleo diet, intermittent fasting, which you used to know, and what does happen that if you're not motivated, and if you consume these diet for 15 to 16 days, that's fine. 15 to 16 days are enough. But on the 17th day, if we will keep a slice of pizza or burger in front of you, definitely your mind will tell that no, eat it. And you will be having that, I have to eat it.
It's temptation.
So you have to really train your mind. That my professor used to tell me once that, see, whatever you eat, it's all up in your mouth only. What's going inside, you don't know.
There's the damage.
Okay, so
what's going inside.
Yeah, so you have to control your mouth and your mind. That's only you will get to become a lean or you will lead a normal life.
Can we put the three together, doctor? Exercise, surgery.
What?
Can we put exercise and surgery together?
Yeah, sure. The thing is, in fact, see, if we are doing a bariatric surgery in any patient, it's not only about the surgery. See, I always tell my patients that clapping always occurs with both hands. It never occurs with one hand. The one hand is like we, as a doctor, we are going to give it to you. The other hand you have to give. The other hand, that means you have to maintain that diet protocol and the exercise protocol, whatever has been instructed to you post-surgery. Then only you will get the desired result. Otherwise, it's not only it's not a magical wand that you just roam around and you will get a lean body like that.
So concern diet, exercise, and surgery. We put the three together.
Yeah, that's true.
Ça qui pour masser. Ça nous besoin veiller pas tienne pour mettre là-bas pour faire passer de pour passer mettre tous les trois ensemble ici poser masser comme ça il y en a beaucoup de monde qui dit pour dire c'est Covid qui blâme le Covid. Some people tend to blame it on Covid because we didn't go anywhere. We were asked to stay at home. It was
but
just
COVID
eating,
is over
going
now.
in the fridge every now and then.
COVID is over now, so they cannot give that much excuses till like post 2 years of COVID now. So yeah, definitely COVID was a game-changing in the health scenario. In fact, post-COVID, most of the patients are getting this heart issues and cardiovascular issues. But yeah, you cannot give this reason for like quite a long time.
Can we give credit to COVID now?
You can give a certain aspect of 5%, that's it, but not
A
more
certain
than that.
percentage.
Yeah,
Yes.
definitely. Because your health really got bad in that COVID time, because with the severe COVID ratio which the patient used to have, they have much more of the cardiovascular accidents at that time. So definitely they're, especially the one who are older age, they definitely have some trouble in walking much more, or but they can be monitored. We can do it. There's nothing like that.
Et nous peut mettre la télévision, bien sûr, un petit portrait, un petit vidéo, en même temps qui nous peut causer combattre obesity with nutritional counseling. Doctor, do you do nutritional counseling also?
Yeah, absolutely. We used to do, and we used to tell them that what can be the best thing to have according to your weight. All right, but see, only the diet counseling will never work. It's all about the diet and the exercise. That both combines and gives the best result if you are persistent. If I'll give you diet, if I'll give you the type of exercise which you have to do, and after 15 days you are just skipping that, okay fine, in 1 week I just skip for 2 meals, that doesn't work like that. You have to be consistent, you have to be dedicated, then only it will work. And it takes time. It's not like if you'll do diet for 1 month and you want the result. It doesn't work like that. At least 3 to 6 months, then you will feel that some 3 kg or 4 kg or 5 kg is being shed. But you have to be consistent with that.
Parce que temps seguinte, ça veut dire nous besoin beaucoup de patience. Dans la cour, quand nous mangeons, nous mettons, et vous mettez vite, là, pour tirer ça, ouais. Il prend plus que, par combien, le docteur dit souvent, on ne pas décourager, on ne prend pas chance. Dans un mois, il pas pour sortir ça qui donc il n'a envie de sortir. It will take time. Like the doctor dit 3 months onwards.
Yeah,
then
definitely.
Only then we will start shed the kilos.
And that too 1 kg, 2 kgs, like that. And this is the time where the patients used to give up. Like, no, I cannot do what, man. I have just did strict diet for 3 months and I just shed 2 kgs or 3 kgs. But that is the key. You have to be consistent and you have to have patience. Then only you will get the results. Otherwise, no matter what you do, you will never get it.
It will never work. Pour avoir résultat, si vous n'avez pas patience, si vous n'avez pas discipline pour le corps, vous pas pouvoir résultat. But doctor, say a person is coming to the Victoria Clinic today and is coming to see you, want some counseling, some advice before she or he will want to do a surgery. What do you do?
Yeah, normally, like how we used to counsel, whenever the patient used to come, we always used to see the patient first, that what kind of percentage the fat he or she is having. And according to that only, we used to calculate the BMI, the weight and the height. Straight away, if the BMI is more than 50 or 45, straight away we used to tell them to have a surgery, because that part will only work on him. Normally what happens, that if the patient is having more than 40 BMI or 45 BMI, they will tell you that, no, I will try some of the exercise and some of the diet. Fine, you do it. But what I have seen in my experience, that these patients used to shed some 6 to 8 kgs of weight, okay? But they will definitely, again, they will regain that weight in certain period of time. So that is like not a game-changing thing for him. If the patient weighs 150, what a 6 kg loss will do? Nothing. Nothing. It's like just taking a drop from the ocean.
Yes,
so it's like that. So you really have to have some 50 to 60 kg of weight shred in that person, so that the person should feel better. And so depending upon like when we used to see the patient, we have to calculate the BMI first, and also the medical history of the patient, whether the patient is taking any medications, whether the patient is having any problem. After asking the symptoms, after taking the history of the patient, then we used to tell them that what procedure or what management should be advisable to you and how it will work. That's what we used to do.
Ou qui peut imaginer, qui peut hésiter pour descendre contre Victoria Health Clinic, voilà, qui moyen autres faire les temps ou entrer ou capable mettre col pour appointement, on met au capable de working et ben di monde qui là, je t'ava diriger qui pour faire, je t'ava voir, je check tout bonnes affaires, BMI, bien même c'est bonne option qui en a ou capable servir bien si. Let's talk about the surgery now for the benefit of the people. They are asking question, what is the side effects, how do you do it, and it's for how long? The questions coming in.
So the thing is, we used to do it by laparoscopic or a robotic procedure. See, the thing is, this procedure means it takes almost around 45 to 1 hour to perform it. And we have two kind of procedure in this. The laparoscopic procedure I'm talking about. It's like restricting the size of the stomach and a bypass surgery. All right. So that all depends on what's your liver condition is. So if your liver is like a grade 3 fatty liver, normally in the patients we used to get it, the obese patients, or grade 4 fatty liver, or something like a cirrhotic liver, we never used to tend to have a bypass surgery in that. We always used to restrict the size of the stomach. That will only give the best result to that patient. All right. So this is the one part. Second part is like now the procedures are coming like endoscopic procedures of having the restriction of the size of the stomach, endoscopic sleeve gastroplasty that is called as. So all the procedures, what I'm telling to you, that all depends on the BMI of the patient, that what is the BMI and what is the age of the patient, is there any patient having some serious comorbid conditions like type 2 diabetes, high type 2 diabetes, high glycemic index, then only we used to opt whether the patient should go for a bypass surgery or for a restriction of the stomach called a sleeve gastrectomy in that. But at last resort, it all comes on the intrascopic finding of the liver. If the liver is bad, don't do a bypass. Just we always used to restrict the size of the stomach. We used to come out. That only gives the best result to the patient.
When you have a person is having too much cholesterol around or in the liver, can they do the surgery?
Yeah, definitely. See, if you will not treat these patients with a surgery, nothing will gonna change. Like they will take the medications for lifelong. But if you do the surgery, we have seen the patients, like if we do a surgery to a patient who is having this diabetes, like this hypertension or high cholesterol, when they lose weight, a tremendous amount of weight, all these things, whatever the comorbid condition is being associated with this person, that obesity, that all used to get resolved with the time being. We have, that's why it is called as bariatric and metabolic surgery. So metabolic part is this only, like to correct the metabolic thing of that person.
More questions coming in. They are asking, Doctor, what is the recovery time after surgery?
So recovery time is like, since it's a laparoscopic procedure, we always used to make the patient walk after 6 hours of the surgery only.
That's it?
Yeah, 6 to 7 hours of the surgery. The important factor with obese patient is the faster you make the patient walk, the faster will be the recovery. And that's not an open procedure that we will cut from here to here. It's just a laparoscopic keyhole surgery. So it's like a 5 mm port. We used to go inside. We used to do the surgery. We used to come out. We used to make the patient walk within 7 hours of the surgery. Next day, we used to tell the patient to have diets as well, the liquid diets. And if everything goes well, everything goes fine, on the next day, means on the second day or third day, we used to discharge the patient as well.
Really?
Yeah, the one who has a sitting job, they can do the sitting job as well, but definitely they have to walk in between that.
In between that.
Yeah.
As simple as that. Aussi simple que ça. Pareil, nous disons bon gaz que on n'a pas rien. Side effects, doctor?
Side effects, basically, there are nutritional side effects. And those side effects are there when the patient doesn't follow the order. Like we have to follow the patient. We have to tell the patient that you have to be strict with your diet and exercise regimen, which has to be given by the doctor or the dietitian or the physiotherapist for 6 months at least. Because these 6 months are crucial for him, because they used to shed a lot of weight in that. Okay, so if you will not be stuck and if you will not be disciplined with your diet, which has been given by a doctor or the hospital, definitely you are going to have some kind of weaknesses like that, weakness, dehydration. See, we used to tell the patient to have 2 liters or 3 liters of water every day. If you are not taking that, definitely you are going to have weakness in that. And that's a common sense kind of thing. We are telling you not to smoke. We are telling you not to have alcohol for these 6 months. At least if you have taken a big leap for your obesity with a surgery, then definitely you should have those kind of discipline in your life so that you can have the best result.
Discipline, at least pour 6 mois, ça tout sorti loin, comme si tout ça sacrifice qu'on fait pour perdre au moins 20-25 kilos après, comme si pour entêter, comme si on continue à faire bonnes affaires. Alors ça, nous discipline avec nous le corps. Moi, tout une bonne question. Does the clinic provide post-surgery care?
Yeah, because it's like one-on-one. In fact, what I used to do, even if the patient doesn't follow, because the patients are like, just get the surgery done, and whether I'm getting time or not, I'm getting this or not. We have made such kind of group that I can ask few questions to those patients that are you facing any problem, are you facing any difficulty, how can we manage it, and how you have to do something like that. In fact, in my practice where I used to operate my patients, even if the patient doesn't ask, I used to ask them that whether you are feeling any problem, how much weight you lost, and these things definitely you have to be very much particular about. Then only this surgery will be a success.
More question from our viewers. Ask doctor, how much do this surgery cost, doctor?
Normally, see, the thing is, if you'll go to some other place to get this surgery done, normally these surgeries are like a quite expensive one if you go to some other places to go for it. But since we have started at this place only, definitely we will consider about all these things, and we'll see that the best can be given to the patient so that they cannot spend their money in traveling and staying over there. And it's always better to get themselves operated at the same place with your relatives nearby rather than going to some other place and getting the confusion that my relatives are not, they are not getting any support from those things. So it's better to get it operated. And cost is nothing like a big deal for that, because you're the thing is you are having your health thing. Okay, if you are not having your health, what will the wealth do? Nothing will do.
Il concerne nous la santé, et même façon nous peut dépenser en l'autre qualité, comme on dit, dans le redress, ça nous fait nous servir, ils viennent parler avec nous les corps, pour nous dépenser, pour nous rester vivants, pour nous traiter nous les corps, bien si, par exemple, le docteur peut dire, mais seulement pour gagner une conversation, bien si, parce que Victoria Health Clinic là-bas, ou si vous gagnez une conversation, le côté prix, il concerne. We were talking about BMI. Now, our question is, what age group are considered for the surgery?
See, I have operated a patient of 8 years also.
8 years old?
Yeah.
For obesity?
Yeah, and I have operated a patient of 80 years also. The age is not a considerable factor, because there are something called as genetic association with the obesity as well. So we have, see, there is a tremendous rise in childhood obesity at this scenario, at this time, because we have seen so much of the school-going kids who are so fat and they are just busy in playing mobiles and tablets and other things.
Eating chicken and chips.
Yeah. And this is the thing where we as a parents, we have to consider, because the parents are the one who has to be strict with them. You should not see the present happiness of that boy. You should see the future happiness of that smile. Okay, then only you will make that child a healthy person in future. So because of that genetic factor in that boy, which we have operated, like 8 years of age, weighing 95 kg. So we have operated in that patient because he was having some genetic problem. So yeah, this age cannot be a factor for this obesity treatment. Definitely, the associated comorbidities can be a factor. Like if the patient of 80 years old having severe cardiac problem, so we will never consider them to go for a surgery, because we'll tell them to have some medicines or something like that. Because we don't know whether that heart will work for him or not for such a long duration of time. So we have to see the patient first, and then we have to decide whether the patient is fit for surgery or not.
There's the answer to your question, doctor. For clarification, can some of the obesity problems related to genetic or not?
Yeah, definitely. Because there are some syndromes which is there, like called as Prader-Willi syndrome or leptin deficiency syndrome. These syndromes are there which can lead to obesity, especially in the young boys. And that's why I told you, like when I have operated one of the case, that patient was having Prader-Willi syndrome. So definitely genetic contains like 40% at least to make you an obese person, because if obesity runs in your family, that means there is a chance that you will also having the same effect if you will not consider your health as a major issue in that, because you really have to work hard, okay, in that you have to really have to discipline yourself so that those genetic factors should not be much more get influenced in you for having a obesity.
So it concerns discipline, but it's also your willpower.
Absolutely.
To do things.
Absolutely, absolutely. Because at your family, they will be eating so much of bad things, and you will be eating the salads.
That happens every Sunday. The family reunion, it's happened every Sunday. There's 10 to 15 kinds of dishes.
One time is okay, but it's not like you should not incorporate every day in that.
C'est ça que nous dit. One time, it's okay, do not feel guilty about it. Mais seulement, pas faire tous les jours à cause après tu as dit que mon boutine sorti pareil moi tu dis bon nous la pangue vente man ici ban spare parts pareil nous dit après nous peut faire guiter nous peut ici nous peut là-dedans pareil moi dit mais seulement solution il y en a c'est côté Victoria Health Clinic it's all under one roof at Victoria Health Clinic
It's all under one roof. It's all under one roof. You don't have to go anywhere else.
you don't have to go anywhere else tout ça là il fait côté Victoria Health Clinic situated à 11 étoiles,
Yeah.
bien sûr, vous êtes capable de prendre un petit bis à là-bas, n'importe quelle façon, ou arrive là-bas, et là-bas, il fait tout quelque chose. Pas besoin de tracasser pour nous la panque vente, pour nous ici, pour nous là-bas. Docteur, il est capable de tirer, il va dire tout bon quelque chose, the best option for you. Docteur, il qui va dire, bien sûr, côté Victoria Health Clinic, what are some daily dietary tips to help someone to lose weight?
It's all about your. See, I'll give you a mantra, kind of thing. There's something called as negative calorie deficit. Okay, you should be in negative calorie deficit. Then only you will lose weight. It's not only about the diet. It's about the physical activity and the exercise also. If you are consuming some 600 kilocalories in a day, and if you are losing only 100 kilocalories, so that 500 will be a positive calorie in your body. And that is not for one day. You are having this for several days, and that will lead to obesity. Okay? So if you are having this 600 kilocalories in a day, you should lose at least 800.
800.
Then only you will be in negative calorie deficit, and then you will lose weight. Okay? And in that calorie also, the most important thing is high protein, low carb, and healthy fats, and quite a good hydration. Avoid alcohol as much as you can, because no matter what you can see, you can give 1,000 excuses for not doing it, but you will not get one excuse to do it. Okay, so that's the thing you have to consider.
That's the things you need to do. Elle nous dit tentation en parlait aussi, ils ont un grand rôle, les tentations, hein, nous avons un petit fonction, nous comprenons, empathie, nous comprenons, mais souvent, ça fait tous les jours que nous consommons l'alcool, cigarette en excès, tout ça là, tentation, et tout ça là, il aide pour mettre bonne quelque chose dans le corps, la graisse, cholestérol, pareil, nous dit, bonne fatty things, tout ça là, il est incorporé dans le corps. Somebody is asking, is BMI really accurate?
No, it's not.
No.
It's that's what I told you. There are so many ways to tell you that whether it is whether you are overweight or obese. Like, but BMI is the one which you can calculate at your home also. That's the thing, because you see it's 5 to 10% upside and down. It's like at least you will get to know what you are in that whether you are overweight or obese. But if you'll go really into the perfect and accurate method, there are so many methods and there are so many instruments which we can help you to get what is accurate in that. But that accuracy will tell you only that you are overweight or obese. That we can tell you by calculating a BMI as well. There's nothing like that.
There's the question, answer to your question. Somebody is getting curious. Does doctor do only this kind of surgery? What else do you do, doctor?
See, I am expert.
They want to visit you.
I am expert in bariatric surgery, but since I am a surgeon, I am doing all sorts of surgery, like the laparoscopic, the general surgeries, and other things as well. So that depends on like the patient, what patient is having. We can perform like gallbladder surgeries, the hernia surgeries, everything can be.
Gastric bypass.
Gastric bypass. So you are talking about the bariatric thing. So I'll tell you, bariatric gastric bypasses. That's what I told you. Bypass and the restriction of the stomach. These two procedures are normally done.
And someone is asking, can a tummy tuck be part of the surgery?
Tummy tuck is a part of the surgery, but that depends on like normally what we used to do for this tummy tuck. We used to operate a patient for first the bariatric surgery. Then when the patients lose a lot of weight and they have a saggy skin, after 6 months to 1 year, then only we used to go for a tummy tuck so that the patient will having a good figure and a good shape in that. It's not about you are having a BMI of 50 and you are doing a tummy tuck surgery. That will not work.
Doctor, as a surgeon, what will you advise or what do you recommend the public officials to do?
I have seen datas. See, we all have to talk with the data. So in the data also, we have seen that every year in Seychelles, I'm particularly talking about.
Yes.
If you'll go to World Atlas for Obesity 2023, you will see that there are 3.5% rise of obesity every year in Seychelles.
In Seychelles.
So that's because of your lifestyle.
That's
and
alarming.
yeah, that is alarming, and that in fact not only 3.5% for an adult person, but obesity is also getting increase in the childhood phase as well. So that is alarming, because see, that's what, like, you party, you do whatever the way you want to do, but at least look out for your health, because you are only going to live in your future. Who else?
Yes.
Okay, so
Voilà, bonne advice qui docteur peut donner là bon matin. Mais sur les plus encore, pareil, on nous dit, fais une petite visite, bien sûr, côté Victoria Health Clinic, en 7 étoiles, là-bas, il y a tout docteur là, on va voir nurse, on va voir tout bon dit, tout ça là pour vous mettre tout en guidance et ou à guetter, so nous pour bon option qui en a, bien sûr, il concerne l'argent, oui, mais souvent si on a l'argent d'OPS, dans le portefeuille, pourquoi pas, ou on traite ou la santé d'après qui il devrait être. Someone is asking about metabolic disorders.
yeah, the metabolic disorders which I have discussed earlier as well, these are basically the diabetes, the hypertension, the cholesterol levels. Because of that, you are having this osteoarthritis, sleep apnea. So I told you, you tell it and you will have it. So bariatric is not only about the game of weight loss, it's also about the resolution of the comorbid conditions like these which I have told you. So definitely you have to look after it. Metabolic, the thing which the viewer have asked me, it's all about the high cholesterol level, all the biochemical parameters which is being increased because of the obesity. You have to correct it up. That's the thing.
A question from one of our viewers just come in. Good morning. What are the treatment for a thyroid growth, yet all test shows it is normal?
If the patient is obese, I'm just telling you regarding this, definitely the patient will be having some sorts of thyroid diseases. Okay, if the patient is not having that thyroid, that's good. But most of the patients which we have seen, they used to take this hypothyroid tablets for a bigger dose, like 250 micrograms, 300 micrograms. Once you start shredding weight, these thyroid hormones used to be regularized, okay? And those doses which you are taking in a very high amount, they used to come back to normal thing. Like if you are taking 250 micrograms within 3 to 6 months, if you lose weight, definitely you will be back to 100 or 75 or something like that. But if you got a thyroid, what we used to tell to the patient that it's better that you should take in the lower dose, because thyroid is a regulatory gland which regulates all your body. Okay, so it's always better to take something in to regulate that thing. Okay, so it's advisable. You should take in a small amount, but that also depends on what body fat percentage you are having. Yeah.
It all depends on your BMI. Somebody is asking if they are very thin, skinny, but it's only that the saggy part on their belly.
That's
a tricky one.
Yeah, so you first always what I'll advise, first try for yourself. First try with yourself. It's not about only going to a surgical aspect, man. It's all about, like, you are opting this option, you are asking this question because I don't know whether you have tried it or not, but you just want to get rid of that fat.
Yes.
Okay, so just try with yourself, because it's not only it's a matter of only not a 6 months or 3 months. It's a matter of your life. If you will be if you will indulge yourself in the exercise and other patterns, the hypertrophic exercise, definitely you are going to do this exercise for your lifelong as well. So it's all about lifestyle modification. This is where the lifestyle modification used to come.
Needs to come. People of Seychelles, if we need to change our lifestyle, nous besoin en discipline avec nous les corps, sinon à la côte bien si Victoria Health Clinic là-bas côte il concerne tout bon quelque chose par nous dit pour un plus bon gagner un plus bon diagnostic par nous dit un plus bon option. Bon docteur qui est spécialisé dans sa bonne affaire, autres là, bien sûr, quand Victoria Health Clinic, autres sont capables de passer là-bas et là-bas discuter tout bonne quelque chose. Pour y aussi, mon magazine est capable de discuter, they're asking if the price can be negotiable.
That can be done, but the thing is we have to see the patient first. It cannot be.
They have to report.
Yeah, definitely.
What causes to have a big belly?
Oh man,
alcohol.
You said
cholesterol.
Definitely.
Nous déjà dit, we have said it all the way. Cholesterol, fatty food,
especially alcohol.
Alcohol, especially.
Alcohol.
Yes.
There's something called as beer belly.
beer belly, the big ones.
The big ones.
Il dit ça, mais get more ventre, ça gros ventre, mais ça même ça. Il conseille nous ça qui nous dit nous va consommer de la bière, ou ça nous manger et manger qui gras tout ça là. Il est capable bon facteur qui pour faire nous gagner bon ventre, mais si on envie essayer coupe tout ça là, voir docteur, bien sûr, côté Victoria Health Clinic ou capable faire mais seulement pas retourner encore là bas cause de temps en temps pour faire ça bon quelque chose. Doctor, before we conclude, they're asking an average price. Maybe they are considering their purse.
See, the thing is, we should never tell about the price on this because every person has different kind of what is called as the comorbid conditions. So we have to see the patient for that. That's what I'm telling you continuously. First, we have to assess the patient. Then only we can tell what price can be given to you and how we can help you. Okay, it's not only about the price. Okay, we have to see, but that price definitely will not be that much that you will be having. So that if you are going outside and you are having those kind of surgeries,
they will not take a loan.
Yeah. So definitely,
yeah.
we have to see the patient first, and then only we will tell that what has to be done further.
Doctor, any successful stories in Seychelles?
In Seychelles, like definitely, it's like my visit here, but definitely we are going to make success here.
Yes?
Yeah, definitely. I have been successful in my patients where I used to work over there. I'll tell you one example of my patient if you
yes.
give me some time. I got a patient of 150 kg, a male patient, and he told me that he was having severe narcolepsy, means that he was having continuous a severe amount of carbon dioxide in his body. He was talking to me and he slept for 4 times.
Really?
Yeah, while talking to me only. He slept like this. So I realized that this person needs a surgery because the thing is, he was on a BiPAP or a CPAP machine which the doctors used to give them to have a normal breathe at night. He was using that for 12 years. Yeah, and he told me that since past 12 years, I didn't sleep for 6 hours straight. I used to sleep while sitting.
Wow.
So can you imagine that what that person was going through since last 12 years? And when we operated him, it's like I think 1.5 months back only I operated him. Within 1 month, he came to me with a weight loss of 16 kgs.
Really?
And his narcolepsy went off. He was off from his BiPAP machine, and he really came to meet me after driving his car because he was unable to drive his car. He used to tell me that when I used to drive my car, I used to sleep in between. So can you imagine that how dangerous situation it was?
For 12 years, huh?
Yeah, so that's why this is very much necessary for those person who are suffering. Otherwise, I told you, you can give 1,000 reasons for not doing it, but you will not get a one reason to do it. And it's all about your health. Wealth will not be of any use if you are not healthy.
Dream come true for him. Ou rêve aussi, si c'est celle nous rêve capable de vivre vrai, pareil, dit tout problème, il y en a une solution, bien sûr, et au côté Victoria Health Clinic peut offrir sa service, bien sûr, ici, même dans celle avec nous, nous pas besoin de avion, pas aucun pas. Alors, ça va passer côté Victoria Health Clinic et on est capable de gagner un causer, gagner une conversation avec Bandi Moun après la docteur, il a dit what is on the best option qui est available là, c'est celle qui concerne nous la santé, discipliné avec ou les corps, sinon, for sure, you have to do the surgery, otherwise, for the discipliné avec ou les corps. Doctor, before we conclude, any last word?
Be healthy. That's your only one life you got. And it's your one life, you have to give your best in it. And if you will be healthy, then only everything and everyone will be happy. Otherwise, it's not about only a party and other things.
Of course, it's not about party, visit a doctor. I'm sure you will be getting some walk-in patients today or tomorrow. Alors, ça pas hésiter pour prendre une petite visite côté Victoria Health Clinic. Ou un docteur là-bas avec les autres professionnels de la santé qui sont capables d'aider pour au propre bénéfice, pour au propre la santé. Là, ça nous donne dans la terre, pour moi, nous qui dit là. Alors, pourquoi pas nous dépenser avec nos propres les corps. C'est celle là aujourd'hui nous type cause bien sûr l'obesity. It has been an absolute pleasure, doctor.
Thank you
to
for
join
having
me this morning.
Yeah, thank you. It was an honor to represent.
Absolute pleasure. Et moi aussi, je remercie Madame Daniela, merci, Payetalis, qui nous fait qui nous fait possibilité pour nous gagner sa petit entretien aujourd'hui bon matin. Et Madame Daniela aussi, il a côté Victoria Health Clinic, qui est capable de demander pour voir lui aussi, ou à gagner tout bon conseil et guidance qui besoin. Alors ça c'est le passe côté Victoria Health Clinic pour ou la santé. Et ça, c'est aussi le topic conversation.